Welcome to North Wales Aesthetics Clinic. I am Karen. We are all concerned about coronavirus, so in this video I am going to take you on a tour around the clinic to show you the journey you would take throughout the clinic when you visit us for a consultation or treatment. We understand that coronavirus crisis is a very worrying time and that you may be feeling really anxious about coming to the clinic. And for this reason, I wanted to reassure you and let you see how I and my staff will keep you safe when you visit us. Now, putting into practice new protocols of working and providing the solutions to keep everyone safe and to prevent anyone from contracting or spreading COVID-19 and in fact any virus, bacteria or germs. I can assure you I feel absolutely confident that we have put into effect sufficient measures to ensure the safety of our patients, visitors and staff. So let me show you how we will organise our patients and visitors around the clinic. So firstly, I want to bring your attention to this barrier here, reception. When you call at the reception at the end of your visit, a member of staff will be behind the reception barrier, minimising the level of interaction with you. This clinic is now a completely no-touch facility, so payment will be taken by telephone transaction, so you won't have to touch anything at all, you simply stand here behind the barrier. So when you arrive, a member of staff will greet you here and ask you to stand here, and then we will triage you, this member of staff will triage you and ask you questions about have you been in contact or been exposed to anybody with COVID-19, and the level of risk will be determined. So unfortunately, we will not hesitate to refuse entry to anyone who has been in contact with anyone or who is displaying symptoms of COVID-19 and who will be putting lives at risk. At the door, you will be asked to put on some overshoes, and some of our patients will be asked to wear a mask. And for good practice, you will be reminded to maintain a social distance of 2 metres at all times. For the safety of everyone, and all the staff will be wearing PPE of various grades of PPE, and we'll also be maintaining a 2 metre distance by adhering to the stop tapes here on the floor. Then you will be escorted by a member of staff and taken straight down this corridor here to the wash facilities, where you will be observed washing your hands for 2 minutes, and sanitising gel will be dispensed onto your hands, and when we will do this each time that you enter a room or you leave a room. Now, as you can see, continue with the no-touch concept, all the doors are kept open, so you won't have to touch any surfaces at all. Now, the reason behind a no-touch concept is because we know that COVID-19 and other harmful bacteria and germs can spread and be contracted through respiratory droplet generated by laughing, talking, sneezing, touching contaminated surfaces. For infection prevention and control reasons, we have closed the waiting room, as you can see. And once you have washed your hands, we will then take you straight down this corridor here to one of the treatment rooms where I will be waiting for you. So let's go down to the treatment rooms. Thank you, Sarah. So prior to coming into the treatment room, the whole room will be suitably sanitised, disinfected and made safe for you. I will be wearing fresh, clean PPE consisting of mask, gown, apron, gloves, face shield, and even one of these powered air purifying respirators that Sarah's kindly wearing for us. So Sarah is wearing her powered air purifying respirator, and as you can see, the superior respirator covers the whole face, head, chest, neck and shoulders area. The room air is filtered, just turn around Sarah, the room air is filtered by this very fine filter system, removing hazardous particles and contaminates, including COVID-19. This amazing apparatus allows us to perform any treatment, even high-risk procedures, and be in front of our patients for extended periods of time that traditional masks may restrict. Not only is this high respirator higher grade than the highest grade FFP3 mask, offering ultimate protection, but it has the added benefit of being extremely comfortable, and it even blows lovely cool air through the hood. Now the hood does not restrict us in any way, so we can wear this unit all day and sanitise it in between our patients. And thank you, Sarah. So for anyone wishing to have a consultation or discuss treatments, there is another barrier here at the desk, and this allows you to review our before and after portfolio photography on thoroughly discussing treatment options very, very safely. And as you can see, the treatment rooms have a large enough floor space to ensure a safe 2-metre distance is maintained. However, during treatments we are working in close contact with our patients, so a high level of PPE and powered air purifying units that we have will be worn. To reduce your time in the clinic, your treatment will be performed without delay, and then you can return to the reception and leave the clinic without coming into contact with another patient or visitor. And apart from being on the bed, you won't have to touch any facilities or even a member of staff. Before leaving the clinic, we will ask you to wash your hands again, and we feel that this is a very responsible way forward. And in this strict, controlled and measured way, you can have your treatment safely without any worry at all.